Welcome to Pikeville Medical Center's Health Talk. Today we will be discussing polypharmacy. Our special guests are two physicians from Pikeville Medical Center's Family Practice Clinic, Dr. Ronna Compton and Dr. Clint Banks. These two physicians will be talking about the hazards of polypharmacy, what polypharmacy is, how it's detected, and are you at risk? These questions and many more will be covered in today's program, but first, let's find out a little more about our doctors, Dr. Compton and Dr. Banks.
Hi, I'm Dr. Ronna Compton. I am a family medicine and geriatric physician here in the Pikeville Family Medicine Clinic. I'm originally from Grundy, Virginia. I attended the University of Virginia in Charlottesville for my undergraduate education. From there, I proceeded to medical school at the Virginia College of Osteopathic Medicine in Blacksburg, Virginia. After finishing medical school, I completed my residency in family medicine at the University of Louisville and also completed a fellowship in geriatrics at the University of Louisville. Presently, I teach first and second year medical students at the Kentucky College of Osteopathic Medicine here in Pikeville, and I also precept or supervise some of our practicing physicians, interns, and residents like Dr. Banks here in the Pikeville Family Medicine Clinic, as well as see patients my own here in the clinic.
I'm Dr. Clint Banks. I'm a first-year resident here at Pikeville Medical Center. I'm originally from Wolfe County, Kentucky. I went to undergraduate at Morehead State. I completed my medical training at Pikeville College of Osteopathic Medicine, now known as Kentucky College of Osteopathic Medicine.
Polypharmacy?
It has something to do with medications, I'm sure.
Polypharmacy?
I'm not sure what that means. Poly means many.
Polypharmacy is actually defined as the use of 5 or more medications simultaneously. So this can be any patient who is taking 5 or more medicines. That could be prescription medications, over-the-counter medications, also herbals or supplements. It's also defined as the inappropriate use of any one medication. So that could mean, for instance, using an over-the-counter medication like Benadryl for sleep, which is not really the indication for the use of Benadryl. It is also the use of more medications than what is clinically warranted. So that would be, for instance, if a patient is on more medications than they actually need for their type of illness.
Who is at risk for polypharmacy?
Would I be someone that would worry about polypharmacy?
Who is at risk for polypharmacy?
My answer would be everyone's at risk for polypharmacy. If you're taking a lot of medications for different reasons, these are generally elderly people, people with chronic medical conditions and such. So if you see a couple specialists, if you see a couple of providers for anything, I would recommend that you ask your doctor to review your medications.
Polypharmacy.
Are there obvious symptoms of polypharmacy?
Sometimes it's very difficult to know if you're at risk for polypharmacy or if you have polypharmacy. Sometimes there are no symptoms at all. However, as family medicine physicians, part of what we do in a patient encounter is to review all of the medications that a patient is taking. Sometimes when a patient has polypharmacy or use of many medications, they will have symptoms that are a result of the medications, so adverse effects from the medicines. This could be anything from confusion to dizziness, feeling weak. Sometimes patients will have a side effect of a cough from a medicine. And in the elderly are at great risk of having confusion as well as being at risk for falling because of polypharmacy.
What about herbs and vitamins and over-the-counter drugs? If I'm taking all natural vitamins and herbs, that couldn't hurt me, right?
There's a common misconception that herbal, anything that you can buy over the counter is not going to be harmful for you. That's simply not the case. There's certain medications that herbal remedies and over-the-counter medications are actually contraindicated in. So my suggestion would be if you're taking a lot of medications, if you're taking anything like special blood thinners or anything that requires a lot of monitoring, consult your doctor before starting anything new like that.
How can I avoid it?
Am I someone who should be worried about polypharmacy? I'm really concerned about my family. How can I make sure that they are safe when it comes to medications?
The best way to avoid polypharmacy is to have regular visits with your family medicine physician. And during those visits, part of what we do in our office is, again, to review your medication list. Many times we see patients develop polypharmacy by having multiple visits to multiple physicians. And all of those physicians are meaning well, but unless there is a bookkeeper, so to speak, or one person who is keeping a list of all the medicines and making sure they're accurate, it's really hard to know if those medicines could be interacting with each other. So regular visits with your family medicine physician are really important. Another important thing is to make sure when you visit your family medicine physician that you also bring your medicines with you. I have my patients so-called brown bag their medicines, or bring all of their medicines to me in a brown bag. And that includes even herbals, as Dr. Banks mentioned. If they're taking any herbals, if they're taking vitamins, any over-the-counter medicines, I want to know every medicine that they're taking. Patients who visit the urgent care center, who also maybe have hospitalizations or see multiple physicians, are really at risk for polypharmacy. And it's really important that you have one person, such as your family medicine physician, keeping tabs on all the medicines you're on and making sure that all of those medicines are safe and that they work well together.
Are there tips that help you to remember to take your medication?
One thing you can do are these Medi-planners, or these pill boxes you see that lay out every day of the week, AM and PM doses. For some people that helps them a lot, taking those. Also, you can do an alarm system. They make the phone applications, and you can also buy them off the internet and such, that will alarm when it's time for you to take your medicine. For certain people, especially elderly that have some onset of dementia, for them remembering to take their medicine is a big problem. So a lot of times it's helpful to get the family involved with those people to make sure that they're compliant in taking that. Also, you can put medicine at a commonly visited place that you're at a lot during the day, so hopefully you see that and you can remember it more.
How can family members help?
How can I help?
How can my family members help?
Right. Family members can really help their loved ones with taking their medications properly. This is extremely important in patients who are elderly and may suffer from dementia or cognitive impairment, memory loss. One of the best things that family members can do for their elderly loved one is, if possible, to visit their family medicine physician with them. So to actually go to the visits and make sure that they are aware of the medications that their loved one should be taking and how to take them properly. We see many times that our patients, especially those that have dementia, take their medicines improperly, and that's also a risk of polypharmacy. So it's not just the use of too many medicines or use of medications for reasons other than what they're indicated for, but taking a medicine improperly, such as at the wrong time of day or taking medications together that shouldn't be together, that's also polypharmacy. So if family members can be very involved in physician visits, that's really important. Another thing that family members can do to help is to also clean out the medicine cabinet in their loved one's home. So we all know that over time we collect medicines in our medicine cabinet, and many of them are expired and really are not safe for us to take. And a lot that are in the cabinet we may not even be taking at all. So it's extremely important, especially in an elderly person's home, that the medicine cabinet be cleared of all medicines that the patient is not taking, and especially to properly dispose of all the medicines that are expired. That also really helps. Lastly, one of the other things that a family member can do is to help administer the medications to their loved one. So as Dr. Banks mentioned, there's different types of tools out there to help an individual patient take their medicines properly, such as a Medi-planner or the pill box or an alarm system. But sometimes, especially if a patient has dementia, it's really important that the family member actually administer the medication. So even if the loved one is independent and able to live on their own, they may not be able to remember the right time of day to take their medicines. So that may involve the child coming to visit their parent to actually give the medications during the day. Sometimes it involves also having a home health nurse be involved in helping to ensure that the patient's compliant with their medication, or even a phone call. Sometimes a phone call system works where the daughter or son calls the patient during the day to cue them or remind them to take the medication.
How does polypharmacy occur?
How does polypharmacy occur?
Well, how does polypharmacy occur?
There's a couple different ways that this happens. The most common that I see is probably a prescribing cascade. What that means is you're prescribed a medication for one reason, a side effect develops for that, you're prescribed another medicine for that side effect, and on and on and on. So you really don't have any primary etiology for your second medication other than the side effect of the first. So if you can find a better medication for the first medication for the condition, sometimes you can avoid these. Also, sometimes people get the same type or class of medication from multiple providers and use different pharmacies. And then the pharmacy doesn't catch this, and so they'll be on 2 redundant medications. A good tip would be to only use one pharmacy to get your medications. That way, if you forget the names of your medications or things like this, you can always reconcile this with your pharmacy. Your clinician can get in touch with them. So that would be my input. Do you have anything?
Yeah, I would also add that it's really important that you know what medications you're on. Many times we have patients who see us in clinic who don't even know the medications they're taking, and that's usually because they're confused about what they should be taking, because they have multiple physicians who are seeing them, maybe have had ER visits, hospitalizations, been to an urgent care, so they're not really certain what they should be taking themselves. So keeping a list of your medications is extremely important. Even carrying the list of those medications with you in your wallet or in your purse is exceptionally important. If you were to be in an accident or to be brought to the hospital, that's the first place that providers would look to find out what medications you were on. Along with your driver's license and your identity, we look for a list of medications, because if you're alone, we don't know what you're taking. So keeping a list of medicines is important, and I can't stress enough, like Dr. Banks mentioned, going to one pharmacy as opposed to going to multiple pharmacies is extremely important. I have had incidences in my training and in practice where I've had patients come to the ER or be hospitalized that maybe were confused, had had a stroke or various other types of medical illnesses, and were not able to tell me their medicines, but maybe they could recall or tell me their pharmacy name, or maybe their loved one didn't know their medicines but they knew the pharmacy that they went to. So then I could call and talk to the pharmacist and find out exactly what medications that patient is taking. So going to one pharmacy is important, and keeping a current list of medications with you is extremely important.
Are there over-the-counter meds that we should avoid?
Absolutely. There are many over-the-counter medications that can actually be dangerous to us if we take them or if we take them improperly. Many times, just like herbals, patients often believe, and it really is a myth, that if you buy something over the counter because you don't have to have a prescription to take it, many people think that that means that it's completely safe. That's not always the case. Over-the-counter medicines are reviewed by the FDA. They are looked at to see if they are safe, but it depends on the patient population. So for instance, in elderly patients, I often see in my geriatric practice a lot of older patients who use medications to induce sleep. And that is very, very, very dangerous in the elderly population. Benadryl, which the other name for that is diphenhydramine, is often used not only for allergies, but also as a sedative to induce sleep. And it's very dangerous when it's used to induce sleep, especially in the elderly population. The medications on the market that have PM after them, so Tylenol, PM, Advil, PM, anything that has PM after it, the way that it induces sleep is it actually has Benadryl in it. So if you look on the back of the bottle, it will actually say diphenhydramine is in that medication, and that's actually Benadryl. So that's how it induces sleep. It's the same as taking Benadryl. It's just a compound of like acetaminophen or Tylenol with Benadryl. The reason that these are extremely dangerous in the elderly population is they have what we call anticholinergic properties. So they have a great propensity to make patients confused. They also experience dry mouth. They can have difficulty with urination and have inability to urinate because of these medicines. But the biggest side effect that I see is acute confusion. And when elderly patients become confused, they're also at great risk for falls and great risk for fractures and other morbidity, mortality, or high-risk events related to the fact that they've fallen. So that is one type of medication that we see that's really used over the counter that's not safe. One of the other classes of medicines that is really not safe when used in the elderly population are what we call the NSAIDs, or the non-steroidal medications. So those are medicines like Aleve, Advil, Motrin, ibuprofen. When used in small doses under the care of a physician, and when you have regular monitoring with labs to assess your kidney function, they can be safe. However, older folks often have problems with their kidneys. Some have kidney disease, or kidney failure, or they just don't excrete or metabolize the medication the same way they would 30 years ago. So you have to be extremely careful when using these non-steroidal type medications in the elderly. I always advise my elderly patients that the safest thing they can take over the counter if they have pain or a headache really is Tylenol. If you have some type of liver disease or cirrhosis, that may not be the case. So you want to discuss with your family medicine physician if Tylenol is safe for you, but for the majority of patients that are elderly age, Tylenol dosing is much safer than Motrin, ibuprofen, or Aleve. I educate my patients that if they have an ache or pain at home, that it's okay to take Tylenol, no more than 6 extra strength Tylenol in one day. So that's a total of 3 grams within one day. And I educate them that if they feel that they need something else more than that they need some other kind of supplement or need to take something else over the counter, to call me first so that we can really discuss what's safe for them in the type of illnesses that they have. So the rule of thumb really is, if you're not sure about over-the-counter medicines, talk to your family medicine physician to make sure it's safe for you before you start taking it.
And something that I thought I'd add to that is a lot of medication, especially the pain medication now, has Tylenol in it too. So if you're taking Tylenol as needed for headaches and things, you also need to watch the dosage that you're getting from your other medications that contain Tylenol as well.
Right, so make sure you talk to your family medicine physician, because a lot of the prescribed pain medicines also have Tylenol in them.
I don't have to worry about too many pills. I choke on them, so I just crush them all up. That's okay, isn't it?
I always worry about my dad remembering to take his medications. I wish I could come up with a plan.
When patients become elderly and they have trouble with things like swallowing their medications, it's really important to talk to the family medicine physician about how to properly take the medication. Many of the medications that are in a tablet form also have a concentrated form or a liquid suspension. So there are many times that we can change the patient from the tablet form to a liquid form that they can swallow much more easily. It is very important that patients and loved ones not crush medications to make them easier to swallow without consulting your pharmacist or your family medicine physician first. That's extremely important. A lot of these medications are extended release forms, so they're meant to work over an extended period of time, like 24 hours, for example. And if you crush the medication, you make it an immediate release form. So the patient gets the full dose of that medication all at once. And that can lead to acute confusion, can be very serious, can cause a lot of problems, and could potentially even lead to death. So it's important that you talk to your family medicine physician or your pharmacist first to find out how to properly dose the medication, to find out if there's a liquid form available, and to find out if it's safe to crush that medicine before you actually do so.
How can talking to my doctor about polypharmacy make a difference?
How can talking to my doctor help me with polypharmacy?
Talking to your family medicine physician about polypharmacy can make a big difference in your care. I will give an example of a patient that I've seen recently. A couple months ago, I had an elderly lady who actually saw me here in the practice, and when she first came to me, she was taking about 20 medications that were on her medication list. And she was here with her daughter, and her daughter was explaining to me that over the past couple months, her mom had actually lost about 13 pounds of weight, had no appetite, had completely lost her appetite, seemed very confused, just wasn't herself anymore, and was really sad, just not lively, was not the mother that she knew from before. When I looked at the patient's medication list, I actually found that she was on multiple medications that treated the same illness. Also did some lab work on her, such as cholesterol or a lipid panel, and actually found that her cholesterol was extremely low, so low that she did not need to be on the cholesterol medicine anymore. And this really was just a cascading timeline event that took place over many years, that everyone that had prescribed the medicines at that time, the medicines were likely very appropriate, but she had accumulated all these medicines over the years and really had not had a reconciliation or someone to look over her meds in detail to find out if she still needed to be on them. So there were many of those medicines she'd been on 20, 30 years that now that she's older and the aging process has made her body function differently, she doesn't need to be on those medicines anymore. So there were about 10 medicines on that list that over time I was able to take the patient off of, that she does not need anymore. And the last time I saw her a couple weeks ago, she had gained about 8 pounds of weight. Her appetite was back. She was eating very well, also doing Ensure supplements, and her daughter feels like mom's back to her old self. She's smiling, she's much happier, and she's not confused. So this is just one example of the types of things that we see in clinical practice when patients have polypharmacy.
One thing I could add to that as well is I can't stress the importance enough of actually being proactive and asking your family physician about your polypharmacy. If you're on multiple medications, say, you know, hey doc, do you think there's any meds that I can come off of possibly? You know, if you're there for a sick visit or something, a lot of times the doc doesn't have the time to actually sit down and think through your medications. And if that's the case, usually most doctors would be happy to schedule you another appointment to see you just for that, and there's nothing wrong with that.
There has to be more information about polypharmacy. Where can I find it?
Absolutely. The best place to find information about polypharmacy really is first to talk to your family medicine physician or your primary provider. They will be able to instruct you about polypharmacy, to look at your medication list and find out what medications are really appropriate for you. One of the things that I want to make sure that all of you out there know is that medications are good, and they're good uses for medications. There are a lot of illnesses that we can treat and make great progress in making you healthier and much more well with medications. So it's not that medicines are necessarily always toxic. What we're saying today is just that you really need to look at your medicines with your family medicine physician and find out what do you need to be on and what may be that you don't need to be on anymore, because sometimes we see those medicines interact with each other and have toxic side effects. So medicines have good purposes, but it's important that you're only on what you exactly need. So talking to your family medicine physician is extremely important, and another great resource is talking to your pharmacist. Your pharmacist has a wealth of knowledge about medications. That's what they're trained specifically in, is medications. They're more knowledgeable about side effects and such of medicines even than we are as physicians. That's their primary training, is medications. So taking the time when you go to pick up your medicines to ask your pharmacist questions if you have questions, or take just a moment of their time to review your medicines and really go over that with them would make a huge difference. They're invaluable. They have a huge, huge amount of knowledge that they're willing to share with patients. So talking to your family medicine physician and talking to your pharmacist would be a good avenue to go.
Thank you for joining us today for Health Talk. If you have questions about polypharmacy, feel free to contact Pikeville Medical Center's Family Practice Clinic at 606-218-4800.